First, I want to start talking about where in the body the heart is located. I think that somewhere along the way we learned that the heart lies over on the left side of our chest more than it truly does. It's a substernal structure. However, it's not exactly in there straight, and it does protrude off to the left side just a little bit. I think the example that we're looking at here, we all have variations in our anatomy, and I think that hers may even protrude off to the left more than what I think is probably normal, but none of us are going to be the same, and certainly our patients that we see in EMS are rarely the examples of health that we would hope to be. So I will next here add in a few boundaries. I've added in the diaphragm, so you can see the diaphragm here. The diaphragm, just a very, very thin muscle that attaches down at the base of your ribs and then comes up, as you can see, kind of right around the sternal notch. That separates the abdominal cavity from the thoracic cavity. We also have highlighted in green the aorta, and then in yellow over here the inferior vena cava and the superior vena cava. Those are all connected with connective tissue called the mediastinum. That will separate the right side of the thoracic cavity from the left side of the thoracic cavity. So there's two completely separate cavities there. The outside boundaries of the thoracic cavity is going to be your visceral pleura, or that lining that's lining on the inside of your ribs. If you've ever eaten smoked ribs, and there's like that membrane on the inside, that's going to be the outer lining of the thoracic cavity as well. All right, next I want to take a look in a little more detail these major vessels that come off of the heart. So again, we're going to see our aorta that comes up. It has an aortic arch, and then the descending aorta. We have three branches that branch off in the aortic arch, and then over here, underside, you can see the abdominal aorta that descends down to the leg, through the abdomen and to the legs. Returning from the bottom, here's the inferior vena cava that's going to come back, and we'll look at in a minute, dump into the right atria. Here is the superior vena cava that also dumps into the right atria as well. There I've added the lungs back in. Like I was saying, I think that this heart is probably protruding and pushing this lobe of the left lung over than maybe what is typical and baseline. Also keep in mind that one of those mediastinal structures that we were talking about is the pericardium, the sac that surrounds and encapsulates the heart as well. So this would not be the view if you were actually looking at it, but we've removed that just so that we can see for this purpose here. All right, I'm going to make a crude diagram here and map the circulatory system as it goes through the body before we go any further. And we'll just say that these four boxes represent the four chambers of the heart. I'm going to start here with the left atria that pumps blood to the left ventricle. This is oxygenated blood, so I'm going to make it red, kind of pink, I guess. And it's going to go out to the body and the brain. Then we're going to have deoxygenated blood that comes back via the vena cava. Sorry, I went off the screen there. Via the vena cava, back into the right atria, right ventricle, and that deoxygenated blood is then going to get pumped out to the lungs via the pulmonary artery, where gas exchange will occur, and we'll take oxygenated blood back via the pulmonary vein. So what you see here, the heart just simply acts as a pump, but really It's best described really as two separate pumps that are just connected in one structure. There really should not be, after we're born, there really should not be any communication between the right and the left hand side of the heart. So really they're kind of like two separate pumps contained in one organ. All right, so here I've removed everything but just the heart. Even the major vessels are gone. I just want to review looking at the heart from the outside from this perspective on a virtual cadaver, what these structures are. So this is oriented basically how it would be sitting inside the person if they were facing you. So on the anterior surface of the heart here is what we're looking at is right ventricle. So it sounds kind of strange. You'd think right would be on the right side. Think about it as being in there kind of at an angle. So really the front or the anterior surface of the heart, what we're basically looking at is the right ventricle. Here behind it, this is the right atria. You'll notice that from the diagram that I made of the box with the 4 squares was grossly inaccurate in proportion of size. So these are the atria here. Their sole job of the right atria is to receive blood back from the brain and from the body, and then pump it into the ventricle and squeeze that ventricle so that when it squeezes, it gets a good hard hit. On the posterior side, here we see the left ventricle. Just looking at this from the outside, the left ventricle does not appear to have as much mass as the right ventricle does. However, it does. It's significantly larger, as a matter of fact, and that's going to be significant for us when we get into looking at trying to interpret EKGs. The left atria that pumps blood into the heart would be this structure right here. So this is the left atria, and it receives blood again back from the lungs via the pulmonary veins, and then hyperinflates that left ventricle so that the left ventricle gets a good hard kick when it contracts. These little grooves here, this is called a sulcus. This kind of divides the atria from the ventricle, and it's present in both places. When we look at the coronary circulation in a second, we're going to notice that those grooves, so now we're looking down through the top, is where 2 of our major coronary vessels lie, and then we have a third one here that runs down between the 2 structures as well. All right, so next I'm going to break the 2 circuits apart. We're going to look at the right side first, the pulmonary circuit, and then we'll look at the left side systemic circuit. So what I have here is just the right atria and the right ventricle, and all the left side and the left side's major vessels or great vessels taken away. So here we see the superior vena cava, inferior vena cava, and those both you'll see dump in separate places right into that right atria. They do not meet up and converge somewhere prior to getting back into the heart. They have their own separate entry points. So after the atria squeezes, you'll notice that we have this valve in here. I can even take that let's take my right ventricle away just for a second so we can look at this valve. So this is our tricuspid valve, and its sole job is to keep blood from backflowing from the right atria that was just there from the right ventricle back into the right atria and traveling the wrong direction. So this valve kind of closes like this. You'll see these cords, they call them chordae tendineae, and they're attached to tubular muscles called papillary muscles down in the ventricle. What those muscles and these cords responsibility is to not let the valve flip back inside out, kind of like when the wind pulls away on your umbrella and it goes upside down. So the valve is closed like this, and there's pressure from the ventricle that is what causes it to seal, or should cause it to seal, and those cords in the muscle keep it from going completely inverted. So I'm going to put my right ventricle back in now. And so from the right ventricle, when it contracts, you can see that it pumps out via the pulmonary trunk and then travels out to the lungs to receive oxygen. There is also a valve up here. Let's take a look at it real quick. So this is our pulmonic valve. So again, it just keeps blood from traveling, from systemic resistance from traveling back into the right side of the heart. All right, now we've jumped over to the left side of the heart. So the left side of the heart is going to receive blood back from the lungs via the pulmonary veins right here, and then into the left atria through another valve, the bicuspid valve or mitral valve, and into the right ventricle, the left ventricle. The left ventricle then pumps back up out through the aorta. So we have the aortic valve here that causes the systemic resistance that's residual in the aorta to not let blood backflow back into the left ventricle. It's going to come out the left ventricle, through the aortic arch, distributed through upper extremities in the brain, and then down to the abdomen and lower extremities. Good. All right, I want to look at some of the structures of the heart in just a little bit more detail internally. So to do that, I'm going to make a slice. Here, and I'll reorient us to where we're at. So this would be the person basically facing forward. So this would be the anterior right ventricle. Here, the left ventricle. I'm going to cut up like this here. So what you notice is this left ventricle is significantly thicker. It is a lot stronger of a muscle than the thin wall of the right ventricle over here. Now the right ventricle, it just does not have the strength, but it didn't have to pump very far. The lungs are in proximity, extremely close to the heart. So it doesn't have the sheer strength that the left ventricle has. It is still a high volume pump though. So it is moving a lot of blood through your lungs at any given time. I think I've heard up to like a third of your blood could be in your lungs. So it is moving a large volume, but it doesn't have to move very far, and it's not exactly high pressure either. Now your left ventricle, on the other hand, does have to pump systemically throughout your body. So all of that resistance that it has to pump against involves a much stronger muscle. And so that's why we see this larger muscle here of the left ventricle. When we're looking at the muscle, we have 3 layers of tissue, but really what we're looking at is the middle layer of the myocardium. So we have the endocardium. It's just I think it's only a few layers of cells. It's just a lining on the inside of the ventricle. Then we have the myocardium, which is the meat of the muscle, the major large part that we see. And then we have the epicardium. The epicardium, again, I think it's only a few layers of cells, if that. And I guess it is visible to the naked eye, but really what we're looking at mostly when we see a cross section like this is myocardium. A lot of times when people say, if there's a question that says, what's the outer layer of muscle tissue, our head wants to leap at pericardium. Remember, that's the sac. It's a mediastinal tissue that is contained around, or contains the heart within it. Its job is really to provide some lubrication and a little home and hold the heart in place, and provide that lubrication so that when it's beating, the tissues don't become irritated on the outside. The next structure I want to come over and look at is the atria. And the atria have a couple of interesting points of interest that we should take a look at. But you'll notice that if I highlight this, it says right auricle. We don't talk about that as existing as much as maybe is necessary, but here we have our right atria, but then this little appendage called the right auricle. Auricle, if you're familiar, is also a name for the part of your ear. It kind of looks like an ear, but it's not an ear. Hearts don't have ears. But what its job, it really is a overflow or an overpressure for the atria. So if we have a excessive amount of pressure returning from either the lungs on the left side or from the brain and body on the right side, this kind of acts as an overpressure chamber here, this auricle does. So it generally does not get expanded all the way out, but that's what its purpose is for the most part. And also as a source of blood clots in some people. What you can kind of see up here in the auricle is all these little pockets that blood can lie and coagulate. And so people that have AFib, this is a lot of times where they have a blood clot that originates. And so we do have an auricle on both the right atria and the left atria that just act as a overpressure expansion chamber when receiving blood back to the heart. All right, so we talked about the heart acting as a pump, and it pumps blood. However, we also acknowledge that it has a lot of muscle tissue, and muscle tissue, as we know, needs blood. So it does not get its blood flow from the blood that it's pumping itself. It's getting its blood flow from its own coronary circulation system. So what I have here is I've taken this heart, and the green is the right side, the yellow being the left side of the heart. And anterior surface, so we're looking at the person facing us right now. What you'll see is we really have three major coronary vessels that we like to talk about. Yes, I know, before I get a lot of emails. There's really two, a left and a right, but we think about it like three because the left bifurcates into two other major vessels very quickly. So I mentioned previously about the sulcus, that little kind of fold or valley here between the ventricles and the atria, one on each side. So effectively we have a left circumflex that comes and runs down the left side of the heart. We have a right coronary that comes and runs down the right side of the heart. And then down the septum, or the divider between the two ventricles, we have our left anterior descending coronary artery as well. All of those are branched off of the aorta. So in the case of the right coronary artery here, there's just a little opening in the aorta that we'll look at on a pig model, that after the ventricle contracts, blood travels up out of the aorta, and then that residual pressure, so that systemic vascular resistance during diastole, or when the heart is relaxed, that systemic resistance causes blood to drain down through these coronary arteries. So the coronary arteries are fed, and the heart is oxygenated while the heart is relaxed. On the flip side, if I come over here to the left coronary or left main coronary artery, you'll see again it has its separate opening off the aorta. This is our left main. However, the left main very quickly, it's not a long section, very quickly bifurcates into our left anterior descending that travels between the two ventricles, and then we have our left circumflex that comes down the left side of the heart. Who feeds the inferior? Well, it depends, and that's something we'll talk about later when we look at different parts of the EKG and interpreting EKG. But remember, just like how most of us are similar looking, if you were to describe somebody's face, they have two eyes, a nose, and a mouth, yet we all look very different. So generally speaking, this is the overall rude and rudimentary map of the circulatory system. However, everybody is going to vary a little bit and even change over the course of their life as oxygen demands are have been narrowed and maybe other arteries come to fill in. And so but this basic overall design that we can anticipate to see on most people. All right, so let's put it all together into one animated and moving object here. So again, reorienting us, we have anterior surface of the heart, right ventricle here, our aorta coming up out of the top. From the left ventricle, we also have out of the top the pulmonary trunk as well. Here's a good look at the valves operating, and I'll show them to you kind of separately, but you can see that what the action of those valves closing is. Each one of these is called a cusp. So the tricuspid valve has 3 cusps. Bicuspid on the left-hand side, we call the mitral valve, has 2 cusps. And there's a good look at our aortic valve and our pulmonic valve as well. So here I've just kind of made the right ventricle a little bit transparent to simulate the right ventricle receiving blood from the right atria and then sending it out through the pulmonic valve. Likewise, making the left ventricle more transparent, we can see that bicuspid valve operating and then sending blood out the aortic valve. All right, so here's an image that is of some preserved structures that were removed from a cadaver. These are not CT scans that have been enhanced. This is more like what you might expect to see. You can tell by some of the fat, the visceral fat or organ fat that's on the heart here. But again, I'll go in and identify the right ventricle and the left ventricle. From those, you can see here is our pulmonary trunk that comes out to the lungs. The aorta comes off from back here in the left ventricle. Ascending aorta, aortic arch, descending. This kind of follows the structures of the spinal cord and descends down. We have our renal arteries out to our kidneys and descends on down to the lower extremities. All right, this illustration of gross cardiac anatomy is from a CT image that has not been enhanced like some of the ones that we've looked at. This is just a raw CT, but it has been rendered into a 3-dimensional image. And so I'm going to pull back. You can see the rib bones and the sternum, and here see the heart start to appear. So what you see down here is the diaphragm. So remember, the heart, the base of the heart, sits right on that diaphragm. If I continue in just a little bit further, you'll see we're into the right ventricle. If I go in a little further yet, we see the left ventricle start to appear. I'm also going to come and look at this from the superior perspective. So here, looking down, we have the aorta coming up from the left ventricle, coming up out of the top. The aortic arch is missing. Then we see the descending aorta start back up right over here. This would be your spine. Over here, this is the pulmonary trunk. So coming up from the right ventricle, pulmonary trunk coming out. And we can see that blood flow travel out to the lungs. This point here is a pretty good image of our right coronary artery. Left anterior descending, coming here through the septum. Over in here should be the left circumflex. See if we can find it. So here we have the left main, Here's the left anterior descending, and then if you watch right here as I scroll down, this would be your circumflex. Right here. So circumflex, LAD, right coronary.